Yeah, we're very excited about this. So the social determinants of health, I mean, here's the opportunity for us to take a whole of government approach. We know this is going to be key and critical, and that is really why the task force, we think, can be a great platform to advance some of those collaborations we know are key.
And relevant to the agenda for tonight, you are also the co-chair of the Biden-Harris Transition COVID-19 Advisory Board. Do you have any tips for how we can more successfully overcome some of these barriers that we're facing in getting our patients to enroll in clinical trials and for vaccine acceptance?
Yeah, absolutely. So this is really one of the top priorities for us now in the advisory board. I have the pleasure of co-chairing along with soon-to-be Surgeon General Vivek Murthy and Dr. David Kessler, bringing together really a phenomenal group of scientific experts. And we're working with policy teams that have been kind of at this from the campaign and before. We know that we have a challenge here in terms of communication, messaging, really just general understanding. What's been lacking is some federal coordination, quite frankly, around that. People have questions about safety, efficacy, even cost. We should be addressing those head on. Moreover, right, we need to make sure there's representation, not just in the clinical trials key, but at every sort of decision-making point. And really there has been, and people need to be reassured about that leadership and how that's different today than it has been historically. So we have work to do without question to make sure healthcare providers in particular have the information they need to make decisions about their own vaccination and for their patients.